impact on staff, it can be quite damaging really towards their sort of confidence and psychological well-being. I mean, I myself, I've experienced it firsthand, and it is quite damaging. Like, you come back to work and you think, it's always there in the back of your head that, maybe this could happen again. I really need to think about, what I did before to experience that, and, to try to not have to go through that again.
I came from Luton, and it was really quiet. It was really, really calm and quiet on Luton, but I came here thinking that I was invincible, thinking that it would be fine. And the first week I was here, there was just so much hostility. Because I work on one of the male wards, there was so much hostility. I was terrified. I was really scared to come in. And I didn't want to go to the end of the ward on my own, so people would escort me around because I was so nervous about being there. Not that anything outright, there was no aggression really towards me, but just on the whole it was quite a hostile atmosphere.
I think verbal aggression especially, and that's been quite scary. It's been scary. I've been scared before when people are screaming at me, and it can get quite personal as well, and not always to do with anybody's illness, say. So
I would worry about it all the time. I would think, oh God, maybe I've made a terrible decision coming and working here, maybe I should go back to my other ward because it was so much calmer. But yeah, I took it home with me, and I would worry about coming onto the ward, and I wouldn't feel really safe. But I think that patients at the time felt the same as we did. It was just like the whole ward felt the same.
To work to look after patients, to help them in their journey of recovery, help them to get better and get on with their life. But when you have, patients that are being quite violent or aggressive towards you, it can affect you personally, it can affect you emotionally, it can affect your attitude towards the work, and it can make working on the ward a difficult place. No matter how much you love what you do, over time it almost bruises you emotionally as well as physically, but it's the emotional part that is very hard to get over. So I think it's a slow burn, but it's something that is very difficult to work with, and over time you actually lose interest and passion for the job.
When I first started working on Bevan Ward, it just felt like constant firefighting. I started right at the beginning of the project, and my office is just outside the ward, and I can hear the pinpoint from there, and it would be a good couple of times an hour you'd hear it go off, go onto the ward, or just hearing yelling from the office and immediately going in, and it was this kind of chasing your tail, acting after the fact rather than a more proactive take on it. Also, our sickness rates were astronomical, largely down to staff injury. And when you think about the effect that has on the ward as a whole in terms of staff morale, people feeling frightened to come to work, and then also actually keeping the ward safe by being able to have the right number of staff there, having to use bank staff that maybe don't know our patients, don't know our service particularly well. Like the knock-on effect of the level of violence we were having was just incredible.
I think it changes the whole way that a ward feels, because there was sort of quite a big sense when I first started working here of walking on eggshells a bit. It felt like something was going to happen. We weren't really sure when it was going to happen or what it was going to be, but it just didn't feel nice. And I'd noticed even physically I'd be more jumpy, I'd be looking around quite a lot, if an alarm went off, oh, what's happened now? And when you're in that state, it's you can't think properly. So it's really hard to be properly present with people and listening to them when they're speaking with you. It's hard to concentrate on anything that you're supposed to be doing, because you're always thinking about what else is going on and trying to keep yourself safe, keep everyone else safe. So it's really tiring. It means that you can't give people the support that you want to because you can't concentrate enough. And it's hard to come back to work feeling like that. And those anxiety things, I think you're trying to think oh, well, I'm not good at my job if this is stressing me out. So you're trying to shove it down and ignore it, and then you just feel even worse. So I think people felt embarrassed. I sometimes felt embarrassed about the fact that I was scared of going onto the ward.
think it does change the dynamic of the ward, not only for the patients themselves and their colleagues, the other patients, everybody basically, including the staff, because everyone has to. I think you go into a sort of a minor fight or flight mode, where you prepare yourself, or you maybe treat somebody differently because maybe they have a history or they've done something earlier.
But I think when it came to sort of trickier situations, morale was very poor. People often felt stressed. There was kind of this mentality of, okay, I'm here, what have I got to do to get through the next 12 hours before I go home, rather than having a sense of fulfilment in the job.
The spirits, just lessons, like people don't want to go out of the office because usually if a violent incident has happened, it's not just segregated to just one, it's kind of reoccurring. So people then they're not able to go and do the things that they want to do. They feel a little bit kind of more shut off, and the team spirit is really low. And once that's low, you kind of can't really do the things you need to do for your patients.
But then also for some of our patients, the amount of, when things were bad, the amount of fear that someone could potentially experience while they're meant to be in a place that's keeping them safe and to help them in their recovery and getting them well and back to their day-to-day life, it's only going to have a negative effect on someone.
I think at the time when it's happening, it's not such a big deal to everyone involved. It's afterwards, usually. In terms of with me, I think afterwards, like if it's been a long day as well, at the end of the day, when I go home, it's something I'll think about. I think it can be really traumatizing sometimes, and you don't realise then and there because adrenaline and you're trying to make sure that everything's as safe as possible. But afterwards, it does affect you. In terms of patients, you can definitely see how they're affected by it straight away. They will either come and tell you, or you see them scatter, you see them kind of just staying in their bedrooms. Like it really impacts them really negatively.
I think it was huge because sort of both just the fact that they're hearing, that they're witnessing or experiencing violence and aggression, but also the fact that it's impacting on the staff. It means that we can't be there for them. And there were points where things like the psychology groups just couldn't happen, and that's the space where people can talk about how they're feeling about that, what's happened, the things that's reminding them of, and they just couldn't because we couldn't do the groups because it wasn't safe for that to happen. So they're losing out on the support that they should be getting. It's really difficult. So they were losing faith in us. So like, well, you can't keep us safe. Like, we can't talk to you because there was an incident, and where were you? So it was really hard for them because it's like, who do you trust when you're here? So people talked about sort of being reminded of a lot of the stuff that happened before, sort of that sense of feeling like really powerless. And I think sort of people have talked a lot about that as being sort of a trigger for them being violent as well, that sense of just, I've got no control over what's happening here, I've got no control over my environment, I don't feel safe, and sort of putting that feeling into someone else and just sort of not knowing what to do. So I think it's sort of really bad because we're trying to give people a positive experience of sort of being cared for and feeling safe, and in fact a lot of the time the opposite was happening. And they just felt trapped again, felt scared, didn't know what was happening.
It was really beneficial, and just making it open and transparent as well kind of like helped break down the fear a little bit. And we also started talking about violence in our community meeting. So sometimes I would run the community meeting, and we'd just say, like, do you feel safe? And there'd be staff there and patients, and some people would just say, no, I don't feel safe at all, I'm scared for this reason.
I've seen patients blossom in terms, well, all of us really, well, most of us. Yeah. I'd say 99% of staff are on board in one way or another, yeah? But I've certainly seen patients empowered by their ability to address something that is disempowering, is naturally disempowering, we all would be disempowered if we were threatened, because we're not used to it. It's not average daily behaviour. Touch wood and hopefully long may it last, but yeah. So yeah, I see patients and staff openly discussing things that people used to look at the floor in the past.
I've already said I loved it. Like seeing all the data afterwards, when you see like the reductions and seeing the change in attitudes and seeing patients say certain things, I really enjoyed the process of seeing things actually change for the better, like change in a really, really positive way. I remember during one group, it wasn't community meeting or anything, I think it was art, we were just doing art or colouring or something, and a patient said something that was inappropriate to another patient, and she turned around and said, well, we discussed that this morning and you're actually not allowed to talk to me like that. That's, what was it that she said? I think she said that's verbal aggression, and that's not acceptable on board.
Wow.
And staff are able to be there to back her up. So I've loved the fact that we've actually empowered patients. Like they feel really able to say and stand up for themselves without having to be violent or aggressive back. They're just able to actually just use their words and say, this is how it is, and they're really empowered. It's good to see. We've become so much more open in terms of staff and patients discussions around violence and around aggression and kind of attempting to stamp it out. And with staff, we've become more cohesive in terms of within the team. In our safety huddles, we'll discuss which patient, what issues we have, why they have issues or they're dissatisfied, and exactly what we're going to do about it. So we're planning beforehand how we're going to handle the situations, and it does minimize the violence and aggression just coming about, because we've already discussed beforehand that we know that this patient is feeling like this at this moment, so what are we going to do to kind of keep them calm before anything can happen.
It feels a lot safer having, safety huddles and safety crosses. Getting MDTs together to discuss, violence and aggression, dissatisfied patients it's a really nice forum to share, to get different ideas about how to sort of, what kind of interventions to use for certain, different kind of presentations. I mean, every nurse hasn't always got all the answers, and neither has doctors and managers. But to sort of everyone to share ideas is really good, and even for things for people like students, sometimes when students are involved, when I remember when I was a student, I didn't really know how to deal with violence and aggression. You sort of just backed off and tried to get your mentor or someone to come in and to have them, to have students around, and maybe they might be scared to ask, how do we deal with that, and for them to sit in and listen to that as well. It must be really nice for them as well to learn from those kind of safety huddles as well.
I just think it helps us refocus our priorities and how we're going to manage the day and the situations that might arise. It just really makes us think. I personally, it's not from Gardner Ward, but I love that example that we had from Connolly Ward, where they had thought about, so a lady was dissatisfied because she couldn't see her children, and so their intervention was, get her pictures of her children, maybe, speak to the person looking after her children and see if they can arrange a visit for the future when she was a bit better, and just give her a little bit more hope about the fact that they're not gone forever, it's just for a little period of time. And obviously that was something that sometimes you would miss. If you weren't having that conversation about who was dissatisfied, you wouldn't even think about it, and it wouldn't be until she maybe asked if she ever did
that you would be able to do something about it. You'd just be like, I'm really sorry you can't see your children. Like she'd be really upset, but if you can plan for that and do something, then that person's going to have such a better experience in hospital, and she's going to have much more respect for the staff, for them thinking about her in a more holistic way, not, oh, she's in hospital, she needs medication and sleep, and we'll feed her, and that's it.
The other needs.
Yeah, the really big ones that do make you dissatisfied when you're away from something that you love and you haven't got any freedom.
When you deal with things and have a conversation about things in the early stages before it's turned into anger and resentment, and then from there aggression, you can change the whole story of somebody's admission. It could go from Dave's really aggressive, Dave's really violent, Dave needs seclusion all the time, he's, loads of PRN, to actually he responds really well to one-to-one time, spending time in the sensory room with a member of staff, being able to talk about what's going on for him, getting involved in activities, occupy his time so he's not worrying about these things all the time, and thinking about things differently can just really change the story of somebody's admission.
It means a lot to me. I'm proud to be part of this violence reduction programme. I've worked on Gardner Ward and we've seen a huge reduction over the last 2 years. Now working on Seaford Ward, I think that has its own challenges as well. And as a unit, to be part of such a scheme is quite nice. It's quite a privilege to be part of that, to show this is what we're doing, this is how we're doing it, and there's the evidence to show that this really has worked.
And I think just because I have my own personal experience of feeling really unsafe, to now come onto the ward and feel completely safe and know that patients are safe, visitors are safe, that staff are safe, it enables me to do my job better. It enables me to just be authentic, be myself, and just enjoy being there, instead of always having to watch my back and worry about what's going on.
I'll say thank you all for this initiative that was introduced to City and Hackney, and on Joshua Ward in particular, because there has been violence issues on the ward, which actually demoralized me at one point, but now I feel confident, I feel happy, the ward feel calm, and not only me feeling that, but the rest of the staff and the patients feeling it. And there has been a relative also who was talking to me about how she felt in the past and how they're feeling now, and so there has been that feeling all around, not only me but the team in general.
The relationships amongst the team have really been strengthened throughout this work, and I took the picture that he gave me to the ward, and I showed it to some of the guys, and they got a bit emotional about it, because it's like that difference from last summer, 61 people needing medical attention because of violence and aggression within that 4-week period, to this summer, 14. And it was a real sense of pride that this is what we've achieved as a team by talking to each other. Because fundamentally that's what it is. It's just talking to each other more and talking to our patients more. It's an epic accomplishment.
I guess I was just thinking about, there's a paper that we did in university that I really loved that was talking about sort of the defences that we develop when we're working in sort of caring settings. And one of the biggest things that happens when we're feeling stressed like that and not thinking about it is that we stop seeing people as people. And I think the Violence Collaborative has really helped us to not do that, because we're talking so much about how we're feeling and about individuals. We're getting to know people and I think have a really different relationship with patients. And I think the fact that we're getting to know them like that, it makes your work so much more rewarding, because like these are people that we're working with, they're not just cases. and they're not just sort of like threatening things, which is how it started to feel when things got really aggressive, sort of when I was first on the wards. And that's just been lovely, sort of seeing them sort of flourish as well, because you know, when people see you for like what you are, for your strengths, rather than as sort of a diagnosis or as a patient, like that's when you can start to grow, and people are giving so much to each other, talking about wanting to come back and help out on the ward, they've wanted to help with the project, get involved in like the safety crosses. So it's just been really sort of an amazing project to be a part of. I feel really lucky that I joined at the time that I did.
When you take away the violence, the firefighting, that stress of constantly feeling you're battling against your patients, when that starts to disappear, you open your service up to doing so much more. We've been able to do more creative work with our patients, doing projects that are about the outside world and bringing that in. And in terms of the recovery of your patients, it's so much more peaceful, it's less stressful, it's not this idea, 'cause I work in the PQ, and we've kind of dispelled this thing of, well, you only go to Bevan if you're violent, and people, as soon as they walk through the door, being desperate to go back to the acute ward because they don't want to be in this frightening, violent environment. That's gone. That's not there anymore. I mean, we have our days. That you know, when you work with people, it's always going to be unpredictable. There will always be something, but that could be anywhere. That could be in your local coffee shop. That's just life. But yeah, when you're not constantly dealing with violence and people getting hurt and people being frightened and being stressed out, your staff suddenly have all this extra brain space for thinking creatively about what they're going to do with our service users. How are we going to support them? What can we do to make our environment more creative and fun and driven towards getting our chaps well and home and back to their lives?